as I indicated in the introduction, I'll be sharing our experience of using an interactive voice recording, COVID-19 messaging, and phones. I'll be talking about why we use this technology, what is it all about, how did we use this technology, who was involved, and what are the critical considerations for a success of a technology of this nature. Why I had actually chosen to go for an interactive voice recording and messaging is because from March, the incidence rate, the cases of COVID was actually increasing, and government had put restrictions. Most of the organizations, including CARE, had actually put restrictions of going into the field, but at the same time, we still felt we needed to contribute in one way or another in spreading relevant messages. So because of that, we needed to find a solution which would allow us to reach the people without necessarily us visiting them as we have actually been doing. Again, around COVID, we noted that in the country, in most of the areas, there was a growing myth about COVID-19. For example, that COVID-19 is for people in town, people in the hospital, and the like. And we needed to develop messages to actually present an accurate information. Of course, we also noted that COVID has impact on the impact and our target population. So we needed to actually appreciate how it is impacting them. So this technology was one of those which we thought could actually be relevant. Again, people were sending messages through radio, other means, but we wanted a very targeted message for our impact operation. And this is the technology we found it to be quite appropriate. Apart from that, IVR channel makes it a bit appropriate. It's a bit easy to use for a community which has a higher literacy level like Malawi, where about 64% could be readed in the rural communities. Apart from that, it actually also presents an opportunity that we can send our messages in a local language. So how did we use it? We used this technology particularly by sending voice recorded messages, which the recipients of the village savings and loan members, when they get a call, they actually press a button to accept to continue listening to the recorded messages. We would also use the same recorded messages in a form of a survey. We could also actually send some SMSs to these communities using the same platform. But the platform was also able to give us quick outputs in terms of how we are actually trading, how we are actually progressing, how many we are reaching, and the like. So as I said, one, we used it as a platform for information, education, and the communication. So we are able to communicate or inform or educate village savings and loan members in terms of COVID specific messages, like focusing on transmission, prevention, the myth which are actually there. But we also used the same to spread the message, to educate the groups in terms of how they can adapt their activities as a group of village savings and loan in the context of COVID. Apart from that, we also observed, and because we had done a rapid gender analysis, which informed us that one of the consequences or impact of COVID is actually a high prevalence rate of teenage pregnancies, high prevalence rate of GBV, gender-based violence. So we also integrated GBV in the messages, as well as the government of Malawi developed the new guidelines for nutrition in the context of COVID. We are part of the government stakeholder spreading this message. As I mentioned, we used the same platform to carry out surveys. That's the knowledge, attitude, and practice surveys in the context of COVID. So just to assess the level of knowledge based on the messages we have provided, but the messages also which other stakeholders may have actually communicated to the communities. We used it to the data collection to also get to know the level of impact of COVID in the project participants. The same platform, we used it as a feedback and the accountability mechanisms for this particular initiative, but also a feedback of other COVID-related interventions which we are implementing in the communities. And we are also using it for reflection based on the feedback which we are getting from the participants, which enabled us to improve how we are actually using this technology. One improvement is, for example, we used to start sending the messages on a Sunday, but we got a feedback that on Sunday, most of the people are in the church because they are Christians. Therefore, we had to change to start sending the messages on Mondays. So that's how we use the technology. And who was involved in this initiative? So KMLI staff, KMLI USA staff, we are involved, one, in monitoring how the messages are actually reaching the communities, get feedback in terms of how communities are responding or viewing the messages which we are actually sending. Viamo was Viamo are actually the service provider which are actually we are using their platform to send these messages. We are working hand in hand with Viamo to develop scripts which had to be sent to the communities. Apart from that, Viamo had to also engage local mobile network operators through which the calls had to be sent. Again, the government was involved because the messages which we are developing, we had actually to work together with government to ensure that they are meeting the minimum standards which they had set under each sector. So whether it is a protection sector, a protection cluster, is it a food and nutrition, is it a community mobilization? So we had to share with them so that they also guide us and approve what we are actually doing. The project participants, we normally use the word participants. We know that others actually talk about project beneficiaries, but we use the project participants. So they were involved not only by receiving the messages, but also trying to inform us in terms of the most relevant messages, the most important things which we needed to include. Finally, based on our experience, we think that using a technology of this nature, probably, and other technologies, there are also certain things which we need. One, you need to look at into the issues of context, the context in which you are, the kind of connectivity which you have. For example, Malawi has about 3 or 4 mobile network operators, and we are sending these messages to communities in 9 districts. And you find in each community there is a specific network operator which their connectivity is better, or in other communities probably a certain operator is completely not there. So you have to take into consideration about that. I talked about government approving those, so that's another context which you actually need to do, to consider. In other countries, you can send the messages as you want, but in other countries, they would wish to ensure that the messages are standardized, are meeting the minimum requirements. You need to consider issues of literacy level. So in this case, in this technology, that's why we are using the keypad, and we use any phone, not necessarily Android, even any ordinary phone. Again, context, emerging trends. So I will give you an example. In June, when we started sending the messages, that's when the transmission the incidence rate, the new cases were quite high. In October, you find there was a drop. What it meant, like the kind of message which you had to send has to actually address the emerging issues. One important context is about cost. In other countries, in other areas, cost would be a bit cheaper of mobile phones. Others would be actually high. Again, using this technology, one of the lessons we learned is that you need to also know that it has some limitations. For example, when you're doing a CAP survey, this kind of technology has sometimes a limitation that you cannot collect certain data which requires an observation. So for example, we are asking, has your group started implementing the adapted measures of COVID as VSRA, having hand washing facilities, putting on masks, not handling cash? That's things you sometimes need to observe. One of the things we also noted is that due to context, due to literacy level, sometimes the success rate might actually differ. So you find the number of people who are able to get the calls, the number of people who are able to complete the survey might differ based on a number of parameters. The other success factor is good preparation in terms of developing the tools, developing the messages, understanding to measure why you are doing this apart from measuring the numbers which you are reaching, understanding the context of the MNOs and their capacity. And you need to develop mitigating measures for any limitations which you actually observe. In our case, we had close monitoring, we had reflection sessions, and we were actually along the way addressing some of the limitations, some of the challenges which we are actually encountering. One of the challenges was actually, we had the first survey, which was pushed to the 5,000 people we are sending these messages. The response rate was very low. It was about 12%, and that meant we had to change the structure of the questionnaire. Finally, managing the partnership as different stakeholders are involved in this. And we also need to think about the core objective, which to do with the value for money, apart from the reaching high numbers, allow changing the behavior which you wanted. I think I can stop there, and I invite my colleagues in this room to share what you have, how you have used a similar technology, or to ask questions or just provide comments. Thank you.
Yes, so just to reiterate, thank you, Clement, that was great. If anyone has any questions or would like to discuss similar technology use that they had in one of their own programs, feel free to write it in the chat box, or even better, unmute yourself and ask or discuss away.
Well, thank you.
This is,
oh, sorry.
No, go ahead.
No, it just thank you for the presentation, Clement. Very, very interesting approach. And I am very interested in how many messages did you send, how long the message were, what was the impact of the message? Did you receive the data right away that people react to the message? And then what kind of data did you collect to evaluate the impact of the message? Thank you.
Okay, so maybe I can take those few questions first. Thanks. In terms of how many messages, we were sending the messages every week. Each message we had programmed that it has to not to take more than 3 minutes. Apart from the surveys were taking about 10 to 15 minutes. Of course, the second round we had to reduce the length of the tools, so that we have a higher response rate. In terms of the data, as I said, we are getting feedback. We are actually also trying to know how the level of knowledge about COVID. We are trying to know the attitude towards the issues of COVID towards GBV, but also the practices which people are actually doing in their respective communities. Of course, we have not yet finalized doing the impact assessment because we feel like we need to take a number of variables, a number of situations into consideration. But so far, we have had positive feedback, particularly because our messages were a bit targeted. I think the people have been sending messages on radio, they are on the TV. Most of them were not targeted based on the what we observed in the communities. I'm not sure if I've missed another question. Thank you.
Thank you.
Yeah, we have a couple questions in the chat, but Willie, I know you, it looks like you asked your question in the chat. If you want to unmute yourself and ask Clement, that would be great.
Yeah, sure. So I just wanted to hear more about how you came to use Viamo. Like, was this the first time you used it? And how did you train and convince your team to use it? I know change management with technology sometimes is difficult. And also just understanding was your team completely able to do it with, on their own, or did you have external and global support to help you navigate and design and set up Viamo?
Okay, so this is our first time to interact with Viamo. Our global team was actually the one which actually linked up us with the Viamo. Viamo had to designate a person which had worked with us. So most of the things we had to work together. We had to develop a message sent to Viamo. They had to do a script. We had to check the script and make sure that it meets what we're looking for. Similarly, when the data is coming, the feedback is coming in terms of how many have received the message for that week, how many dropped off, how many. We had to reflect and find why is it like that and the right. So in terms of communities, I think that's where preparation is important, because we had about 3 weeks to prepare the village services and loans about these messages. They were fully aware that we'll be sending messages. Of course, we know that in certain areas, probably the communication was not very accurate, but that was actually resolved. Thank you.
Thank you for that answer. So we have 2 questions that are somewhat related to feedback. So Charles asked, how did you get feedback? Was it free, or was there a cost on the part of the participants? And then Carrie Mao sort of echoed that and she's interested in the feedback portion as well, and was curious if there are additional feedback mechanisms you had besides Viamo, or if that was the only way that you received feedback.
Okay. In terms of the cost, I think the project beneficiaries were not actually spending anything on this project, because it was actually paid by CARE. The messages they were getting were free. Even if they attempted to call back, it was actually free. We were not only using Viamo to collect feedback, we also had other alternative methods. Like we are regularly to have some random calls to get feedback from the communities. But in the surveys too, which we are pushing, we are also including certain feedback questions. In the messages, we are also including other ways we receive feedback as CARE. So we could provide toll-free numbers which people could actually use. We could actually also inform them that they can get in touch with any of the CARE staff which they are aware. Thank you.
Great. I think we have time for one more question. So if anyone else has a question, feel free to unmute yourself and ask it, or we can see it in the chat box. And it looks like Charles wanted to also.
There's a question that Charles is asking, is it free? So what is the plan for sustainability? I think, as I actually mentioned, it's not free because it is CARE which is engaging Viamo to pay for their services which they are actually providing. So it is not completely free. In terms of the plan for sustainability, I hope when you are talking about plan for sustainability, you are only looking at one area, one threshold of sustainability. That's about continuity of the activity. Because in our case, in my case, I consider continuity of the impact of the outcome is also issue of sustainability, which in terms of continuity of changes which have come, behavior changes, we hope it can actually continue because we also partnered with government, we partnered with the communities. Thank you.
So it looks like this breakout room is closing, so I just wanted to thank Clement for his presentation and answering all these questions.